It is 11:39 Thursday, September the 19th. Ain't my baby cute too? And I'm going to be doing the IV piggy bag. So I reviewed my physician's orders, and I have an order to give Zosyn an antibiotic to my patient. I do know that I am going to be giving my Zosyn for my drop factor is going to be 6 minutes, which I'll do that at the end. I'm going to get my equipment, so I'm going to need gloves, alcohol prep, my Zosyn that I'm going to be hanging. I got to have tape for labeling my tubing and my tubing. So I'm going to also look at the Zosyn and make sure that it is in date and there are no particles or anything, or it's not crystallized. And it is. And I do know that I have normal saline in the room hanging, and my Zosyn is compatible with that, okay? So I go in the room, knock on the door, tell them my name, identify myself, identify my patient using two identifiers. I asked him his name, and he's John Doe, birthday 10/17/28. So this is an old man. So I let him know that he's going to be getting some antibiotics because he has a wound and it got infected. So that's what we're going to be doing. First thing I want to go to the patient. Also, I'm going to wash my hands also. I'm going to go over to the site just to make sure that his IV is intact and stuff before I start running fluids, and ask him his pain and all that good stuff. And he's pain 0, IV's intact, no erythema or redness or anything like that. So I'm going to come over to my primary tubing, and I'm just going to make sure that there are no kinks or anything in the tubing. And the tubing looks good. While I'm at it, I'm going to go ahead, look at my secondary tubing, make sure that everything is in the bag, and that's not expired. It's not expired. I'll go ahead and hang this. Alright, I'm going to put my gloves on, wash my hands again, and put my gloves on. Okay, I'm going to take my tubing out. Making sure that I don't contaminate, I'm going to go ahead and spike my medicine. Make sure that's all the way in there without contaminating. I got the end of that. I'm going to go ahead and hang this for just a second. I'm holding this in. I'm going to take an alcohol prep and clean the port that I am about to attach my secondary to. Making sure that I use friction. Okay, now that I have that, I'm going to unclamp it, pull this down, and I'm going to prime, making sure that I hold it lower than the secondary. Put some water in there, open up my and if I open it, you should see it start dripping once everything is open. And it ain't dripping. Too bad from it. I do have all of them open. All my tubes are open. I just don't think it's enough medicine in this bag, but we're going to pretend like it is. Okay. It is back prime, so I'm going to close everything back up for now. sure put some of that out. And while I'm doing this, I'm going to label my secondary tubing. And I'm going to come over and adjust my flow rate, making sure that my patient is okay. And I'm going to make sure that my flow rate is 6 mils per hour. So I'll be watching 6 drops per minute, I'm sorry. And I'll be watching my watch to make sure that my drop rate is right, and I'll be looking there. And I'll do that. And then once I have drop rate set, drop factor set, I'm going to dispose of my gloves, make sure that my patient is okay, and document what was already in there, what's piggybacked my Zocin and everything that happened, and the patient was okay. And that's it.